So, welcome everyone to this GGMC educational webinar series. I'm very pleased and honoured to be asked to facilitate this session and to introduce two of my colleagues, Dr. Amy Nissell and Dr. Bronwyn Terrell from the Murdoch Children's Research Institute, as well as from Australian Genomics and other strings to our bows as well. But firstly, I'd like to acknowledge that Amy and I are dialing in from the lands of the Wurundjeri people of the Kulin Nation in Melbourne, Australia, and Bronwyn is joining us from the lands of the Camaragal people of the Eora Nation. And we would like to acknowledge the traditional custodians of the various lands on which we're all working and pay our respects to elders past and present. So Amy Nissell leads the genomics workforce stream of Melbourne Genomics and previously led the workforce and education program for Australian Genomics. She'll tell you more about those organisations in her presentation, I'm sure. She applies research insights to develop education and training programs for the genomics workforce. Her doctorate was in genetics education, and she's worked in population screening and medical genetics education across multiple sectors. And we also have Bronwyn Terrell speaking today. She works in workforce education, Australian Genomics and clinical translation, the Garvan Institute of Medical Research. She collaborates with researchers and professional groups to develop and evaluate educational programs for health professionals and stakeholders in genomic medicine. And she has international experience in professional and public education. I'm very pleased to introduce both of them and am waiting to hear what they have to say about enabling workforce capability in genomic medicine. Over to you, Amy and Bronwyn.
Thank you so much, Michelle. That's a wonderful introduction, and thank you for the acknowledgement of country. Thanks to the Global Genomic Medicine Collaborative for allowing us to speak today. This is a real opportunity for us to be able to share the work that we've been doing for quite a few years, more than I'd like to count, and the opportunity to really talk about how we increase workforce capability in genomic medicine. So I'll ask Amy to drive the slides as we go today, because she'll have the focus this morning on the research, and then I jump in again at the end to talk a little bit about the tools we've created. The main thing to talk to you first up is that we're putting our acknowledgement slides first, because this was really a huge collaborative effort with input from national working groups and also international expert groups. Because as many of you know, national reports and roadmaps from all around the world have recognised since the early 2000s really, and before, the need for a workforce with capability and skills in genomic medicine. But it's clear that health professionals around the world need to feel informed and confident to be able to apply this new genomic technologies, and many of them don't at this point in time. Part of that is actually about the complexity of the system. There are hugely different funding models, different infrastructure, and different needs across the system. And in our case, in particular in Australia, there are also overlapping requirements or overlapping responsibilities from different bodies, professional bodies, universities, medical colleges, state-funded programs, who have some kind of requirement to be able to actually prepare the workforce in all of the areas of health. So if you could just quickly pop that up for me, Amy. We found that there were a range of different bodies, and there were some massive gaps across this. So at this point, I'm going to pass over to Amy, who can talk a little bit more about the workforces that are required for genomic medicine.
Thanks, Bronwyn. So over the last several years, Bronwyn and I and the people in Australian Genomics, we've really put our thinking caps on and thought, who is the genomics workforce? And we've landed on a definition that is those who use genomic testing, so typically clinicians, and those who do genomic testing, so laboratory scientists and also data scientists. And there's not only a need for the specialist genetic workforce, like the ones shown in the grey box here, but also to make sure that you've got new graduates in medicine, nursing and health, and everyone has the skills that they need to use genomics in their discipline. And it's also making sure that the professionals who are already in practice have those skills as well. So there are all of these people involved in conducting genomic tests, not just the medical scientists, as I mentioned, but also the data scientists who contribute to the pipelines and the software and the databases that are all critical components of the testing pathway. All these professionals have varying roles, and so they all have different levels of genomic expertise that are required, and they need different layers of education and training. And for those who work in that area of sort of upskilling physicians who don't have training in genetics, it's just that one small component of this really large workforce that we're talking about when we talk about genomics workforce development or education. To give you the context of Australian genomics, it's a national collaboration supporting translation of genomic research into clinical practice through tools, resources, data sets, research evidence, community engagement and networks. The work I'm presenting today was part of the first phase of Australian genomics that had 4 programs of research shown here, and we're the purple one on the right-hand side. That program was led by Sylvia Metcalf and Clary Gaff. And this slide also includes photos of some of the people listed on that acknowledgement slide across the bottom, including our working group. Our aim in our program was not to develop education in Australia. We knew that we suspected that that was already happening, but to act in a supporting role for others by identifying education needs, developing tools to support educators, and fostering dialogue and collaboration. When we started this program in 2016, very little was known about the Australian landscape in genomic medicine or in genomic education. Over the 5 years of the program, we conducted 20 projects using mixed methods with over 1,000 participants from multiple professions. We published from all of those studies, and really nicely, the work has been cited or requested by local and international researchers, educators, professional bodies, government departments, and other system influencers. The work identified some challenges in developing the genomics workforce, both at the level of the genomics specialty and for the health workforce that's not trained in genomics. For health professionals, the main challenge was with variability. They were expecting to practice in really different contexts with different supports, pathways, and access to education. We heard uncertainty about their current and future roles and different views about what the scope of their roles should be. And I'll elaborate on that a little in a minute. It was clear that the health professionals wanted continuing professional development in genomics, including those who had encountered genetics as part of their early training. And a theme that emerged across several projects was this desire for foundational learning overlaid with practical or experiential learning. For genomics as an emerging field, there are differences between those who are coming into this with the knowledge of genomics, say through research, and doctors who told us that they simply want an awareness of how genomic medicine might work in their discipline. The rest of this talk is really going to focus on the educator perspective. For the educators, we found that program conveners were mostly clinicians or scientists who didn't have formal qualifications in education, so they often did education in addition to their core role. They didn't have access to information about the needs of their target audiences, and they weren't evaluating their education beyond satisfaction with what was offered. And there was this lack of connection and support. So we focused on lifting up what education was already being developed in Australia to provide the pieces for educators to build genomics education of varying sizes and shapes and complexity, from large-scale masterpieces such as the Sydney Opera House to smaller, less detailed efforts. Here's an overview of our toolkit that we developed, and that's what we're focusing on in this talk. The foundation is a program logic model, and then there are also some needs assessment surveys, an evaluation framework, and reporting standards for genomics education and its evaluation. Each tool is designed to provide easy, practical access to theory and evidence to support effective education and evaluation. And we really focused on removing the theoretical jargon wherever we could. We also established the Genomics Education Network of Australasia as a way of sharing expertise, tools, and resources. For all of the tools, as I said, we wanted to produce flexible tiered resources that could be accessible to as many people and types of education as possible. So for each one, we started with the literature, and then we would convene a working group. This photo here shows the working group of 24 people who attended a workshop to develop the program logic model. And the expert group eventually included 38 people from 5 continents, including people involved with GGMC. We included experienced educators, evaluators, and researchers, but also really importantly, we included those people who are making and delivering genomics education who don't have formal qualifications. We use consensus methodologies to gather input, to co-design and review each tool. And then this meant that we could utilise our working groups networks to test the tools in local settings and also to disseminate, share, endorse and promote them. So the first tool addresses that issue we developed, the backbone, and it's the backbone for the others, education being developed by people without formal qualifications in education. So this tool is really about making the theory accessible. I'll build this slide up slowly, and all of our tools, we've got a QR code later, they're all available on the Australian Genomics website. First of all, you start with the goal of what you're trying to achieve. Excuse me. And then stepping back from that, what are the outcomes? So for genomics education, we defined the long-term outcome as the appropriate use of genomic medicine, with intermediate outcomes being a competent workforce, and then the immediate ones being I met my learning objectives of the activity. And then there's the consideration of who are the stakeholders here, who are the funders, who are the end audience, who are the people that have a stake in my education. Typically a program logic model includes what's required to do something, what it is you want to do, and what's the output of that thing. So for each of these stages of the model, there's a list of what you might do at that point, what the output is, which is then the input for the next thing, and so forth. So in the early stages, you're wanting to consider what it is you're trying to achieve. What is that desired level of literacy, referring back to that diagram I showed earlier. What already exists? What's an opportunity analysis? Is there something that I could adapt potentially here? And then once you're building your product or your intervention, how am I going to promote that? How am I going to deliver this? Who's going to know that they're relevant to come to my intervention? And then once you've delivered it, how are you evaluating impact? What are you thinking about for documentation along this journey? The program logic model is designed to be flexible, obviously, that's one of our main goals. So it's flexible both in terms of scale. So this model can be used for small, local, one-off seminars, and it can also be used for multi-university degrees or competency frameworks. And those examples are provided in the publication available on the website. You can also use it retrospectively to reflect on the implementation of a program. Did the people who came to my event or used my resource, was that what I intended to happen? The next tool, so moving on to the actual tools themselves, starting with assessing needs. We, to address that issue with genomics education in Australia that wasn't being informed by needs of the target audience, we did conduct many needs assessments, and I'm just going to highlight 2 here because there's 2 published survey tools that are available for others. The idea behind the needs assessment is insights from current and preferred practice can help us think about the learning needs and potentially inform policy for implementation. These are just a couple of insights gleaned from one of the needs assessments with physicians across Australia. From interviews, we identified 5 domains that related to genomics practice that are listed here. We call them the 5 Ps. We then developed a survey based on these domains, which was completed by over 400 physicians from 30 subspecialties in Australia. What we found was that over half were already practicing genomic medicine, which we defined as referring or requesting a gene panel or a genome sequencing test in the last 12 months. And then in contrast to some literature, we challenged the assumption. We didn't find any associations between career stage or location and being engaged. So that idea that that we sometimes heard from interviews that the consultants, the more experienced doctors will be incorporating genomics into their specialty, or from the senior doctors, the junior doctors are learning this at medical school, so they'll be the ones who are doing this. We found no associations. Encouragingly, we did find an association between education and being engaged in genomics, which is great. And those who are engaged were more likely to prefer a model of ordering a genomic test themselves with support from their local genetic service. Like others around the world, the majority of our sample didn't feel prepared for genomic medicine. In interviews, physicians said that education would help them feel prepared. And when surveyed about what would help them, the most common response was education. So we also asked about what topics they'd already learned about, shown here grouped into 4 broad categories. Half the group had some form of education in each topic area. But then we looked at associations, and this is where it started to get really interesting. This is a figure from one of our papers. It's busy, but I just want to pull out a couple of concepts for you. On the left, we have characteristics of the survey respondents, whether they're engaged or not, or had completed education. On the right are their perceptions about genomics and their preferences about how they would like to be involved in delivering genomic medicine. What we found was that those who were already engaged with genomic medicine were more likely to have learned about all of the 4 topics, and conversely, those who weren't engaged were less likely. But for some topics, there was a negative association with confidence. So we thought about this a little bit more, and the idea of the conscious competence ladder. You don't know what you don't know until you learn a little bit. And then there's also many different models of care, different extents to which people can practice within their professions, and different people will be at different points. And that's going to be in flux for quite some time. So this range of different practices requires different levels of genomic competence, which led us to think about turning that ladder on its side, reimagining it for genomics, and referencing some implementation science frameworks around champions. So those insights, combined with our survey data, led us to propose this continuum of genomic competency aligned with potential service delivery models. So we need to consider really carefully what health professionals need to develop confidence and competence. And we propose this progression of competence to align with these series of models. And obviously, this is also working within local health service models. What is available? Can a doctor order a test or not? Should you be pushing them to work autonomously when they can't actually order a test and they have to refer to genetics anyway? And then there are enablers and barriers across the continuum as well. So, for example, education together with research is one enabler. Confidence might be one of the barriers. We don't prescribe any particular approach to education with this model. It's just recognising that there are different levels of capability and mastery, and different ways that individuals can get to different levels. So the next tool is an evaluation framework to address that lack of evaluation. When we were in our program logic workshop, a lot of questions kept coming up at each stage about, well, how do I know that? How would I show that? How can I show effectiveness? So we collated all those questions on all the different sticky notes and aligned them with the stages of the model. We also then, as with all our tools, went back to the literature, looked to see what kind of frameworks might be out there that might be relevant, and then we developed and drafted and refined an evaluation framework for genomics education. The manuscript is hopefully going to be coming out in the next few weeks, so please don't do any screen grabs of this particular slide or the ones following. Starting at the top, the framework describes the shifting focus of evaluation from planning through delivery, and then those outcomes, immediate, intermediate, and long-term. The navy boxes through the middle show us what's achieved at each stage. So you start with a plan, and then you have an intervention, and then you deliver that, and hopefully you can meet your learning objectives, and some gains can be seen immediately. The intermediate outcomes that we defined are a genomic workforce that is competent and uses genomic medicine appropriately, which then leads to improved health outcomes. The grey background reflects the potential breadth of stakeholders at each stage. So the barbell shape reflects that it's narrowest in the middle because the stakeholders, when you're delivering your intervention, are simply the people who are coming, your target audience. But the planning and the outcomes, it's much broader than that. And we elaborate on this in the paper. At the bottom, the framework acknowledges that as we move through these outcomes, the influence of the education diminishes because there are external influences. So education might be just one part of a strategy to implement genomics, and there's likely other factors that will affect outcomes, such as workplace readiness for genomics, another implementation science concept. So this may make it hard to attribute long-term outcomes to education, but it doesn't mean that you can't evaluate the contribution of the education. As we were reviewing the literature, we did notice common evaluation questions and measures, and so we conducted a scoping review to complement the framework. When I say we, this work was led by Bronwyn. We searched for both needs assessments and reports of evaluation for programs from the year 2000 onwards. There were over 4,500 papers, of which just over 100 were included in the final review. And again, this publication is coming out shortly. We scraped metadata relating to the evaluation questions and measures and metrics, including diving into all the supplemental materials so that we could create these really detailed tables for people who do want to see how have others done this before me and exactly how have they done it. Like if they wanted to measure knowledge, what were the constructs, what were the questions? Here's just one example from that scoping review, which just really nicely illustrates how a study might be touching off on multiple stages of the framework. It's a study conducted by John Emery, who is an Australian, but it was done in England nearly 20 years ago. And they evaluated the ultimate patient benefits from a computer decision aid tool that they trialled for GPs on familial cancer screening, using a mixed methods design of clinician and patient surveys, along with clinical and software audits at different time points. You can see there's a screen grab of their decision aid that was at point of care in GP clinics. So overlaying the results in their publication with our framework, they were able to show that not only did GPs use their resource with minimal IT issues, but their resource increased GP confidence, which resulted in their required change of behaviour, which was around familial cancer screening, and ultimately benefited patients by lowering cancer worry with no deficit in knowledge. So these were hugely impactful findings that we used to inform design of health services locally. The last tool was the need for consistent reporting. During the scoping review and developing the program logic model, we really found it hard to compare apples with apples. The literature, different terms were used, people described education in so many different ways. So we reconvened and extended our expert group to reach international consensus on what should be reported. So these are known as RISE 2 genomics. There are 18 items that describe education, 12 that describe evaluation, and 1 for stakeholder engagement. And again, you can see the influence of the program logic model coming through all of our tools. As with the evaluation framework, the publication has quite detailed descriptions of each item, and you can get all these publications off our Australian Genomics website, which we'll put the QR code for later. The standards have been endorsed internationally by various associations. And here's the screen grab of our Australian Genomics website, showing where all of these tools and their templates can be downloaded. As I mentioned, they've been endorsed, but also we've started working with several international organisations to adapt the tools. Some of them have been used to inform the development of national genomic programs, such as for Genomic Medicine Sweden and the Health Education England, and others have been used purely for research, such as the Department of Veteran Affairs. That's it from me talking about pointy head theory side of everything. I'll hand over to Bronwyn now to talk about the really practical side of how she's been using these tools. Thanks, Bronwyn.
Thanks, Amy. I love your pointy head thing all the time. Okay, so if I could get you to go to the next slide. You might have seen some very young versions of me in those earlier slides. I've changed roles in Australian Genomics, and my wonder and my best challenge ever is to try and translate all of this work into useful tools that people can use. And part of that is really about helping groups that I get involved with get from the start to the end and navigate some of those choices that you have when you're thinking about conceptualizing and a genomics education process. So navigating those choices. And I guess the other thing I try to do is, if you could go to the next piece, please, Amy, is try to think about how things align. So you saw the program logic and the idea that you would need to align the need for the education with the goals of the program and the content of the education in order to be able to achieve those outcomes. So with alignment and then effective reporting of outcomes for genomics education, we actually have a better chance of getting better genomics education in the future. If you go to the next slide, please. This means that in my role, I spend a lot of time working with genomics initiatives across Australia at the moment, and actually internationally when it comes to some of the needs assessments, to promote effective evidence-based education, which in turn has enabled some knowledge exchange between those groups, and also then identified more gaps and shaped the types of tools that we provide. If you could go to the next slide, please. This is just a depiction of the range of genomics education interventions that are really happening. We noted in the early mapping that there was a huge amount already going on, but they're different shapes and sizes. So they might be looking at different target audiences, they might be in specific areas and applications of genomics, and then other times they're thinking about different products or modalities. Next slide, please. So if you were to go to our site and download the program logic, this is what it would look like. It's not the shiny thing, but partly for printing, partly also for ease of use. But what it does is it takes you through from planning through to outcomes. So I thought I might just align some of those initiatives to that program logic. Sometimes I get involved when at the grant stage, where they're thinking really about what the situation analysis and what would work best. And so, for example, programs that might be focused on a short course in health professional education that's really looking at interprofessional learning, or thinking about new emerging areas. I know primary care education is not new and emerging, but sometimes it is in genomics at the end there. Polygenic scores and pharmacogenomics. If you could go to the next. Other times I come in after the grant has been established and you're really looking at the opportunities, what's gone before, and what to produce, what those deliverables actually are. So for example, some consent support materials have been translated into multiple languages, or in this case, thinking about medical scientists and pathology and how they might incorporate functional evidence in their variant curation. And another example of what we're working on, and one I'll focus on a little closer, schools education. I was really brought in to think about the evaluation and how that might then generate some sustained funding and also some knowledge of the impact of that work. But the primary one I'll just zip through is a set of co-designed health professional education materials. And it was to try to make health professional education more inclusive, to make health professional activity in genetic healthcare more inclusive, respectful, and accessible, particularly for people with intellectual disability. And in this group, what I could do is bring in some views of where their co-design really might need to work into thinking about what health professionals needed to do in this situation, what the workforce was, and what the desired level of capability for those health professionals might be. But then also thinking about a delivery platform, because this is supposed to be an accessible education. The team actually then ended up developing a platform that was built with accessibility from the outlet, and then thinking about evaluation that could generate analytics on the fly. So if you can then go to the next slide, what another of the tools that Amy's already mentioned could then help with is really focusing down. If you want to have impact, publication is really helpful, and reporting. And so some of the descriptions that were in the Rise to Genomics really focused on what you would need to describe for evaluation, what you would need to describe about the delivery to be able to have impact in the literature. So next slide, please, Amy. This group was I think, very successful in that they conducted interviews with health professionals, a website that generated analytics so that could help them to describe their impact regularly and often to funders and to other groups, to be able to talk about and to be able to shift their dissemination plan so that they could handle a bigger sort of media campaign. So next slide, please. This wasn't available at the time, unfortunately. And so as you've heard from Amy, we were working very hard on the evaluation framework. And if I'd had this, this is what I would have done. Part of what I do is try to remove me from the equation, because not everyone can have a salaried professional who can come into the team and just, drop in little bits and pieces and help where there might be identified gaps. So these tools are supposed to replace me when I'm no longer there, or to replace a gap in education and evaluation experience. So what we have created, this is an interim tool, because as you've heard from Amy, this has not published yet, but the draft is up on the Australian Genomics site. And we've got instructions there, which have a set of considerations that were generated through the process of developing the framework and the scoping review, and templates for each stage of the evaluation framework, right from pre-implementation through to long-term outcomes. You'll see that it resembles a bingo card, and there's a reason for that. I'll take you through to an example. So we'll just highlight, we're looking in the immediate stage of the the evaluation framework, and often people are looking for those immediate considerations. What happened directly after your health professional or your attendee attended your genomics intervention? And in this case, we were thinking, if I was to apply this to this last group that I was talking about, it would be about the confidence to use resources. It would be about knowledge of being able to make reasonable adjustments in a genetic appointment, and then also attitudes to making those adjustments. So we would have looked at that. We would have thought about those domains, so the knowledge, attitudes, skills and abilities and capabilities or confidence, and then we would have played bingo. So if you go to the next slide, in here, what we've done is, you heard the scoping review. We took a range of those measures that had been looked at by professionals, by researchers over the last 20 years, put them in a bingo card. So that meant that, Amy, you could actually circle little parts of the bingo card and say, that's actually what I really want to get into. I'm going to look at this particular part of it, how people are thinking about the experience, and I'm going to measure that and gather that information as I go. If you go on to the next slide, please. Oh, what we're doing, Ren, is actually thinking about a set of tools. And those tools are really the building blocks for the work that's going on all around the world, but our particular focus has been Australia. If you go to the next slide, where people create their creations of all different shapes and sizes. So, you know, you can think of potentially something small like a lecture series, might be your little Viking ship that might be in there over there, or something that might have massive number of components, might be your Millennium Falcon. But people are creating these already, and what we have been trying to do is provide tools to make that easier, so that the Millennium Falcon is built a little bit faster. If you can keep going for me, we realize that tools aren't it. And so one of the things we've been also doing is connecting people. People are really key to this process to disseminate the tools, also to avoid reinvention, and also to build collaborations that are really more than the sum of their parts. Nationally for us, that's led to 180 people coming together to try out ideas on each other, to talk about what it is that they've done, to question different approaches. And it's also led to some developing tools, which include national capabilities for genomic testing and medicine for health professionals not trained in genetics or genomics, and a focus on consistent terminology across states and sectors. One of the things that I think really needs to be addressed, though, and is at a national and at an international level, if you can go to the next slide, please, is that thing that we are developing a lot of education, but a lot of it goes into that valley of death afterwards, where the education is no longer supported because the research program that developed it no longer has funding, and there's no sustainable funding in order to be able to make sure that these pieces are available for people to think about, translate, adapt. So on the Australian Genomics site, there is also a set of education materials from a very successful education program with health professionals involved in acute care. And that's up there, but it's really an interim measure at the moment. And one of the things that we're trying to do, if you could go to the next slide there, please, is move these pieces more into your kind of, you know, your pick and mix, where you can look particularly at what people have developed. And if you go to the next slide, thinking about how they can then be sustained and delivered and adapted at a global level. And so work with the Equator Network, work with G2MC, and also work with the IHCC PEG has really kind of started to bring those things forward so that people can use them more sustainably at a long term. So if you could go to the last slide, please, for me, Amy. really, hopefully, we've shown that a national and international approach can be needed, and that there's lots of these tools we know being developed internationally to uplift and to create the capability for workforce and health professionals, particularly, to use genomic medicine. But we're going to need to keep working together, and hopefully we really enjoyed this opportunity to be able to present to you all, and this could be the start of an even bigger discussion. So we'll pull up the acknowledgements one last time and say thank you, and hope that there might be some questions.
Thank you, Amy and Bronwyn. That was great. I didn't say at the beginning of the introduction, but I work as a genetic counsellor, and my first job as a genetic counsellor was in Australian genomics with some of those with the acute care program that you mentioned. So it's very nice to see the theory behind the educational pieces you put together. I don't see any questions in the chat, but does anyone have a question? Just open up a bit so I can see who's there. Stephanie, did you have a question, or just turning on the camera?
I'll just turning myself back on, sorry, just to show my face. But yeah, we'll just say thank you so much for that presentation, and doing so much hard work for all of us who are interested in this space. It's wonderful to have a sort of an overview of everything that's been going on. So thank you.
I might just have, oh, Kate, you've got a question.
Thanks, Michelle. A fantastic talk as all, and I always learn something new. Thank you both very much. And we're thinking in our group about focusing on the non-genetic health professional in primary care. So that's our education project that we're thinking about, called Precise, led by Alan Maher. And so my big question was, are you imagining there's going to be a site through this organisation that we can access all resources? It's an ongoing problem, isn't it? The development of fabulous resources, and then not ongoing funding to sustain them or be accessible or keep them updated. And so I just wondered, is that part of the vision?
Thanks, Kate. That's a tricky one always. I think there have been discussions nationally about the idea of more of a listing, I guess, that can be updated so that people can reach these projects more accessibly. But there are a couple of great projects, and I note that Grant's on the call, that are looking at repositories, so that are happening at a global level, for family history algorithms, also for products of the G2MC. So I've been enjoying some midnight calls to have real conversations about how these things can be made accessible long term. I don't think there are any answers at the moment, but there's certainly a lot of activity, which is fantastic to see.
I have a follow-on question to that. So I think it would be great to have a repository of all these tools. How do we keep them updated, especially as Kate mentioned, funding, it's up and down. Sometimes it's off altogether. How do we keep it?
It's huge. It's a really huge question, which is why there's lots of conversation, not necessarily a lot of answers right at the moment. I know of at least two international networks, and there is also, of course, Genome Ed that acts as a portal more than a repository to existing resources. But so the two big questions are, one is ongoing funding and ongoing refresh, but the other one is also about peer review. So it's there's a sizable amount of work that goes into looking at whether something can be offered, should be offered, and I think somewhere our reporting standards might actually be quite useful as an international kind of framework to be thinking about that. But also then, how do you provide information so that people can access these, because so it's not just a jumble or a collection of ideas and activity. And so there's a lot of people thinking about this. Again, no real answers to that, but I think it's fantastic to see at a global level people considering that.
Following on from that, Michelle, I like that part of the discussions that we have. And again, even just a community of practice faces the same challenge. You need someone like Latifa, who is the coordinator of an educational webinar series, or the coordinator of even just a listserv, to keep people connected globally. We find the same issue in Australia with our Genomics Education Network of Australasia. You just need someone who is responsible for maintaining that list of email addresses and some momentum. And that's currently Bronwyn, and hopefully will continue to be someone, either Bronwyn or someone similar, for many years to come, because what we find is that idea of currency and sharing and awareness of resources happens through a community of practice, but you do need someone salaried to sit and drive it. It doesn't have to be frequently, but it has to be consistently. So you have some brand awareness. And I love that GGMC are doing things like the monthly educational webinar series, well, not monthly, but the educational webinar series, because you get that momentum going. And I think that's what's required to keep things fresh in people's mind. And also, I think one of the ways that we use the Genomics Education Network of Australasia is as a call out for assistance occasionally. Someone, will put a call out. Does anyone know of this resource along these lines that I could adapt? I'm doing my opportunity analysis early in my program. I don't want to reinvent a wheel. Is there something I can have? Or someone might say, does anyone have expertise in this? Because I need to check the currency of my material. So there are grassroots approaches to that, but there's no, as Bronwyn said, it's really hard to find a blanket answer.
Amy and Bronwyn, there's a question in the chat from Grant. From a workforce perspective, what skill sets do you struggle to find?
Amy, you might be best to answer that one.
Well, I just want to clarify first, do you mean from in the genomics workforce, what skills are missing amongst which professions? Or do you sort of mean in the genomics education supporting the workforce perspective, what are we missing? I think it's a little bit horse and cart or chicken and egg for me if we're talking about the former. I think medical specialists or physicians not trained in genetics, the skill set that I struggle to find is the motivational attitudinal one about relevance. And that is the horse and cart bit. It will come, and it's at what point for which profession. I'm not sure if that's answering your question, or if that's a bit too obtuse or philosophical. From the actual different professions, 100% it's data science. It's not actually the medical professions. So the medical professionals and the clinicians exist and have the ability to get the skills, but I think the medical scientists with variant curation ability and the data scientists don't exist. They need to be created. I don't know if that answers, Grant.
It does, and I'm sorry, I just now turned on my my video because I have to admit what I was doing while watching your presentation is, since it's 5 o'clock in the afternoon, I'm at home. I have my office computer with the presentation, but I casted it to another room where I have my big screen TV, and I'm laying on a couch. Okay, so I had to get up off my couch and so I could come back and be part of this conversation. First of all, fantastic presentation. Really, it's making me think about a lot of things. But yes, Amy, you answered my question. I was thinking really in terms of, do you feel like once again, from a workforce perspective, are we lacking the people and the skill sets that we need to really expand and grow the ability to use genetic information in patient care? And I'm glad you mentioned both medical professionals, but you also mentioned on the technology side, the data scientists, and I'm glad you're thinking about both. But can I ask you on the medical side, because this is something that I've been wondering about for quite a while. There's a difference between medical professionals who use genetic testing in patient care between, I know my experience in the U.S. and what is outside of the U.S. In the U.S., it seems like we have asked our general practice doctors or our primary care doctors, along with our specialty doctors like oncologists or maternal fetal medicine, to on their own become geneticists and to order this genetic testing and that type of thing. But I've also noticed, as I hear other people outside of the US, they seem to want to have that done by a medical geneticist, but there's not enough medical geneticists to really do that. So how is the world thinking about what do we expect from our medical professionals? What type of level of genetic skill set do we ask of them? And do we need to go beyond just having medical geneticists do this and actually ask all the other physicians to have that skill set also?
That's a good question, Grant. I have opinions, and also Bronwyn, with her scoping review hat on, has a better global perspective of what endeavours are happening in what countries and what regions. And it's all tied up with that very first slide that Bronwyn presented about the complexity of a health service and an education system. So what we're finding is that there are efforts to get genetics out of or genomic testing out of the remit of genetic services, so that you can alleviate that bottleneck. And there's definitely efforts for that around Australia, or Australia, New Zealand, North America, Europe, but every single healthcare system is different, which is why it took us quite a while to ponder and come up with that diagram that we presented about the continuum, where we realized that there's no point considering pushing people to a level of mastery that they will never be able to apply practically in their local health system. Right. So it's that idea of, we can make observations based on our awareness and talking to people like you and talking to people at different functions and conferences to say, what's it like in your country or your region? But there's in Australia, we're not yet pushing for everyone to have a level of mastery to perform this independently, because there's no funding for tests to be ordered by any doctor. You contrast that with the NHS, October 2018, mandated any doctor can order a genomic test. So they're just totally different systems to work within. So I would say in the UK, they are 100% working towards upskilling every doctor to be able to order this test, because they have the infrastructure to do it. And they set up 7 genomic laboratory hubs around the UK to deal with the influx of testing. Whereas in Australia and other areas where you've got so many different privatised laboratories and different health systems, some regions are set up beautifully, others are abysmal. And so that's why, for me, asking and focusing purely on the medical professionals ordering it is only one part of the equation, because if you order a test and it arrives at a lab that has no capacity to process it because they don't have enough laboratory scientists, that's where you stick. And so the work that I do, wearing my other hat that Michelle mentioned, Melbourne Genomics, we've been going for about 12 years or 11 years now, focusing on that sliding, I use a bullseye target analogy overlaid on that genomic workforce diagram. 10 years ago, we focused on the genetic specialists. There were not enough geneticists and genetic counsellors with genomic expertise, and not enough variant curators. So we focused on just how can we improve that in our small area of Australia. And then we're like, right, we've reimagined the course for genetic counsellors, we've increased the capacity, we've got some training in place for the geneticists. Now let's look at the medical professionals who don't have genetic training. What can we do for them? And we focused on them and for the last 5 years. And then for the last year or two, we've been going, okay, now what about the data scientists? So we've been taking that approach of where is the critical mass and where can we focus our attention? But I hesitate to comment on other regions of the world because everyone's health system is so different.
Mm-hmm.
Slightly passionate response, I'm sorry.
Yeah, you know, I think that's amazing that the NHS has such a forward-moving program. And do you think that will influence your program in Australia at some point?
We've been working closely with the NHS Genomics education program for a number of years. We've been learning a lot from them. There's so much control Bronwyn and I and others involved in Australian genomics have over the approaches we take, but we can't change our healthcare system. But the approach they took to their education was beautiful, very, very, very well funded, several years ahead of the 2018 deadline. They were given the mandate, create a workforce. They created master's programs, online resources, continuing professional development, social media campaigns. They just had such a beautiful range of options, which we look to a lot and we emulate and we learn from. But I don't know that their approach can ever just translate into another setting because not many countries have an NHS, not many countries have free healthcare.
And not many countries have that level of funding in order to be able to get it going to, which
And
it was a dream.
Yeah, and it's still funded, which goes all the way back to Kate's point. Their content is always current because they are always funded. Yeah.
Well, I'm cheering for you guys because you guys you know, and I've been able to be to Australia on 2 different trips, and I just absolutely loved my experiences there, and also all the people that I've worked with that are in this space, you know, in the clinical genetics space. And it seems like you have all the components all ready to go to do everything that anybody else is doing. You have all the components to do everything the NHS is doing. It's just a matter of, I don't know who the decision makers are, say, we want to emphasize, we want to expand the use of genetic information in patient care. And if somehow, and like I say, I don't know what those decision makers are or what the pressures are to get that decision to be made, but it was obviously made in the UK. So, you know, they don't have it's government funded healthcare, but governments don't have endless amounts of money. They have limited amount of money. So they went out and decided that this genetics was going to be a priority. And so that's why they're doing this. And it seems to me like in Australia, you guys are ready to go as soon as
it's a little bit sometimes it's personal stories and personal connections and personal motivations. David Cameron had a personal motivation to get that through the British government. There's one very successful program that was kicked off in Australia from a very personal story about spinal muscular atrophy carrier screening. And so there are particular patient advocacy groups who are very good at seeing an opportunity, but it's the right person at the right time. If you can get the emotion involved in the political decision-making, it seems like a strange answer, but
no,
historically, that's where the evidence is showing how these things get up, is it's the emotion overlaid with the politics and the money. Yeah. Sorry, is that okay to say, Bronwyn? Or is that
absolutely? And I guess
Australian genomics.
And you can definitely see that in American politics as well. So you can see that in any kind of politics. So I think that is absolutely the way a lot of decisions are driven. And I guess we do have a Genomics Health Futures mission. We have and a number of people where there is funding for research in this area and the benefits that have come from it, including the PRECISE program that Kate Dunlop was talking about before. So there's there are pockets of wonderful activity. I think there's the joining up of those is sometimes a little harder than in Australia than it has been maybe in the NHS.
Yeah.
And quickly, I'm sorry, I always have too many questions, but do you find, back to the workforce question, do you find that young people, as they're going through school, are exposed to the opportunities or the vision of, gee, oh, I want to go into bioinformatics, or I want to go into laboratory testing, or, that they're exposed to these worlds, and they're exposed in a way that it's exciting and interesting to them, so that when they decide, oh, this is what I want to be when I grow up, they go to the university, and you start getting that workforce numbers up. Do you see that happening in Australia from a young level, where you're able to reach those young kids and get them started?
Do you want to comment, Bronwyn? I know from
think-
working in the States and Australia, there's a very different ethos. We don't tend to have science fairs and things here. And just a sheer numbers game, there's not enough kids but there are some beautiful initiatives that are going, and I know Bronwyn's overlapped. Do you want to comment on them, Bronwyn? I know that one of the people in the audience at the moment has worked at one of the centres, GTAC, which is targeted specifically at high school and primary school people. You could probably comment better, Bronwyn.
Well, yes, and I realise Latif is would like to probably round this up.
Wrap it up.
I would just be really quick and say a lot of the focus, I think, has been around genetics literacy rather than necessarily genetics careers, and so that's a slightly different approach, but it is because genetics is high in the biology realm, but not necessarily, I guess, potentially in the computer science and engineering realm. It is a different approach, but there are some really great education approaches coming through, including the Science and Schools work that I was doing, which is really about thinking about more genetic health literacy and genetics literacy. But there are certainly some programs that look at genetics careers, and bioinformatics being one of those things.
Yeah,
Coming out of the universities primarily.
Yeah,
Good.
so Melbourne Genomics has got some careers events that we run. I've got another one in about 6 weeks' time, where we're promoting careers in genomics for all sorts of other faculties. So data science, statistical modelling, policy, law, ethics, and it's all on, have you considered that genomics applies to your studies as well? But that's at university. It's not as grassroots as what you were talking about.
So I can see we're a few minutes over, so thank you, Amy and Bronwyn, for a wonderful presentation, and to the audience for very interesting discussion. Latifa?
Yeah, just I would like to mention something. First of all, thank you for this insightful presentation. And as you mentioned, there is a lot of need to raise awareness on the genomic medicine. There is so many things to inform the decision maker and the politician for sure. And I just want to mention for you guys, because you talk about the workforce and education training programs, we have similar things. And we just launched the call needs assessment survey in order to determine the needs for early career investigators, and to know what they need in order to develop their career trajectories. So I'll be more than glad that I can share with you that survey. If you can share it with your collaborator, the early career investigators. We put also our definition regarding the early career the investigators and who can fill out this survey. So I'll follow up with you on that. And for the whole audience, thank you for attending this. I think it's early, kind of not early morning for you Australian, but for other countries it's too early. And for us it's 6:30 p.m., but it's our pleasure to accommodate this region. And please stay tuned for the upcoming webinar for May, for the upcoming month, May, very soon. Okay, and thank you again, Michelle, for moderating this session.
It's a pleasure. Thank you.
You're welcome.
Thanks for having us.
Thank you, everybody.
Thank you, everyone.
Yep.
Enjoy your Tuesday evening or Wednesday.
Bye-bye.